Hi guys, welcome to Sick Conversations, and we are back with our first episode of the year together.
Yeah.
Did you miss us? I hope you missed me with my boo, Don. Yeah?
I know you missed us. How could you not?
Anyway, so today we will be discussing some of the questions that we received from the audience. Disclaimer, we are not doctors. We can only answer these questions to our best understanding. Maybe Don has better...
No, don't take anything I say seriously.
I think you'll start.
Oh, these are top searches from search engines. That's what people are asking Google. What does sickle cell do to a person?
Some of the audience must have sent their questions, yeah.
Okay. Question 1, what does sickle cell do to a person?
I don't know how to answer that question.
What does it not do?
Yeah, what does it not do? Because, from the pain episodes, the mental stress, the emotional stress, the financial stress.
Yeah.
Honestly, there is nothing we can say sickle cell does not do to a person.
Such a broad question, because is it like mentally, physically?
It takes from you. Okay, at least I know it has taken from you.
I was going to say like it makes us independent and resilient and I don't know, corny stuff like that.
Yes.
Because it keeps taking. It takes a lot.
It makes you stronger. It makes you think outside the box. You get to learn how to do certain things in a way that a regular person wouldn't.
Yeah. Yeah, I guess there's a lot of stuff you can and can't do.
Question 2. Is sickle cell caused by witchcraft?
I can't believe people are still asking this in 2023.
I'm so sorry for laughing.
But 2023.
No, sickle cell is not caused by witchcraft.
No, it's a genetic disease.
Yeah.
Passed down from parents, not some witch doctor.
Can sickle cell cause death?
Yeah, it can. Strokes.
The complications that it comes with.
Yeah, seizure, strokes, organ damage / failure. I mean, yeah, it can cause death. A simple infection.
Malaria, flu. Oh my God, anything.
Malaria. How can you treat sickle cell at home?
I think I can answer to that best because I do a lot of home care. But how I manage it at home when I'm in a crisis is we have the painkillers, yes, on standby. Of course, not the ones that are very dangerous. Administered by a doctor, not just anyone. IV fluids also set up by a doctor or a nurse. But then the best way that I feel it's managed at home is if your support system actually understands your disease and they're willing to help you out. They're willing to like basically carry you throughout that whole situation. So that's the best way I think it's managed at home. And I think it's more comforting at home. Yeah,
it's like we talked last week with Dr. Florence. It's just so much better at home to recover in your own space, private space, comfortable space. I was always that type of person that rushes to the hospital immediately, but now I'm tired. Now I'm tired, so it's home-based until I can't move.
Yeah.
Then I'll go to the hospital.
Yeah. Manage it at home until when you feel like it cannot be handled. You need someone who is going to massage your joints when they're in pain. So a lot of that, the massage ointments like deep heat, basically try to keep warm, try to eat healthy. I think that's the best way it's managed at home.
It's weird, deep heat gives me a crisis.
You're very strange. How?
I don't know.
The freeze or the heat? Because there are two.
Either one, the heat especially. I've never tried freeze. I wouldn't need freeze. But I'm guessing
I wanted to try freeze recently, but then
I'm just scared.
I was told not to.
Yeah, but it's the heat for me. Anyway.
Everyone is different, I guess.
Yeah, so what's the best medication for sickle cell?
You answer that. I'm not I'm not on medication for sickle cell. Vibes.
Just vibes. I guess the general doctor would prescribe like folic acid and hydroxyurea.
Yeah, very many warriors are now on hydroxyurea, but unfortunately for me, hydroxyurea doesn't work. Does it work for you?
Now I've been on it so long I can't even compare. But I know if I do stop, the next crisis I have is going to be crazy.
So that means it's working for you.
Yeah, but I don't know what it has changed. Like I still have crises every now and then.
It helps either your crisis, okay, from what I know is that your crisis is either less critical and also it prolongs them. However, when I was on hydroxyurea, I was just sick.
All the time? How long?
I couldn't even go a week.
Because I know they tell you have to take it for like 3 months until all those...
Now for me, for that week, what happened was my blood level dropped to at least 2.
What?
I was dying.
Literally.
I was dying. So I can't even try it. I got on it when I was in a crisis, and instead of my crisis getting better, it just kept on getting worse. Every time they would check my blood level, it was just dropping and dropping and dropping. I think I took it for maybe 2 weeks. I really don't remember. It was the worst time of my life. As soon as I got off,
no more. Back to normal.
I got better.
That's so weird.
So you can't convince me to even try it.
There's so many people who don't use it.
Yeah. What should sickle cell patients eat?
Anything and everything. Don't limit yourself.
Oh no, let me first go back to that question. The best medication is keep stress-free and try to be as happy as possible.
Hydrate a lot.
Yes, hydrate. And have fun. Don't overthink about your situation, because if you think about it, then you cause more problems to yourself.
Comparison is the thief of joy.
Yeah. So yeah, in terms of food, I'm a food lover, so I eat everything. There's nothing I do not eat that causes me any problems, as far as I know.
Yeah, me too. I eat everything and anything. I tried being vegan. Didn't feel any different, except weighing like a lot less.
Well, but do not consume a lot of alcohol. We can't say do not drink. It's advised, but we're the wrong people to tell you that.
To advise.
So just try to moderate your alcohol consumption.
Definitely.
What does a sickle cell pain feel like?
For me, it feels like someone is hammering against my bone repeatedly. If it's not in a joint. If it's in a joint, like have you ever had a crisis that's like in your shin or your thigh? It feels like someone's just hammering. But if it's in your joints, it feels like it's like fire, kind of. I don't know.
What if it's all over the body?
Feels like I'm getting electrocuted. I don't know.
From head to toe. The one I have right now.
It's from head to toe.
From head to toe.
It feels like electricity from head to toe.
Yeah.
Yeah. On
the hammering thing, sometimes I feel like a fat person is sitting on me. Literally, that's what it feels like. If it's on the chest, oh my God. If it's on the chest, it's the chest and the back.
That's one of the worst, where you're just trying to take tiny little breaths.
Yes. You can't breathe, you can't laugh, you can't talk, you can't... No, that one, there's a fat person on the chest.
Yeah.
Exactly. So the one of the head to toe, I just feel like I'm being hammered constantly, every part of my body. Sometimes it's like I'm being pricked with, I don't know, like there's so many tiny needles that don't end.
Ouch. No, can't relate to that one. That sounds terrible.
Yeah, anyway.
But yeah, the bone breaking, being hammer is the most common answer that I've had from people.
I've not had my bone broken, so I wouldn't compare, but I think it's worse. I honestly feel like a sickle cell crisis is worse than breaking your bone. We've also been told that a sickle cell crisis is worse than labor pains. So
remember my mom always telling me that. Can get through anything.
No, we can't. We can't.
It's worse than labor pains. I'm like, it's not the same. Which blood group causes sickle cell?
None.
There's no specific blood group.
There's no blood group that causes sickle cell. It's a sickle cell. It's a gene that causes sickle cell. Can a man with sickle cell disease impregnate a woman? Manang.
I think if they couldn't, there wouldn't be anyone with sickle cell disease.
Right?
Because that's how genes work.
I'd actually not thought about it like that. Yeah, that's why we are many and keep on coming all over. There's so many. There's usually a man involved in this process. What organ does sickle cell anemia damage?
It can damage all major organs from liver, heart, kidney, gallbladders, spleen.
Your brain, your eyes.
Yeah, your eyes.
Your teeth.
Yeah.
There's not anywhere your blood touches, really. Sickle cell affects it.
I met someone who was blind in one eye because she had an embolism because of sickle cell. Just like that. You wake up, she went to sleep and she woke up blind in one eye.
I also saw a TikTok like that.
It's crazy.
Yeah, I saw a TikTok and this girl said she went to sleep and then she woke up blind. That's my biggest fear.
Yeah, I can't, especially in design, not having my eyes. When in a crisis, what position should I lie in?
The one that makes you comfortable. I think it also depends on where your pain is.
Yeah.
Because if you have pain on your arm, please do not lie on that arm. If it's on your leg, do not put pressure on it. If it's on your back and your chest, that's really the hard one. Because
yeah, you can't avoid it really.
Where you feel comfortable is where you should lie. Sometimes when you're in a crisis, you might not even be able to lie in any position because of the pain is just very uncomfortable. Yeah. Can a sickle cell patient marry? Yes, if they want. Don't you want to get married?
I want to get married.
Okay. Yeah, they can get married.
I didn't know I had to ask permission from someone. Can a sickle cell patient marry? Like, how would you stop someone from getting married? I think
to this question, it depends on if it's honestly dependent on your partner. If your partner is willing to be with you throughout the whole sickle cell journey, then yes, you can get married. If they say they are, then later change your mind again, you still got married.
Yeah.
But then I think at the end of the day, we would advise you to pick a partner who is willing to walk through the whole, because it's not only going to affect you, it's also going to affect them, and you're going to need to rely on them a lot.
Yeah, definitely. It's definitely a deep conversation you need to have with your partner, because having sickle cell comes with a lot.
Mm-hmm.
Yeah. But I mean, yeah, go if your partner is all for it, go get married.
Okay.
Go get married. Just want to be here dating for life. What makes sickle cell such a bad disease? Everything we have mentioned.
There is no positive side to sickle cell.
There isn't at all. Is sickle cell anemia chronic?
Yes.
Yes, it is.
Very chronic.
Very, very chronic.
What are the different types of sickle cell disease?
I know like 4, but they could be 6 or 8. I don't know. I know sickle cell anemia, SS, beta thalassemia, which is what my brother had, beta plus thalassemia, which is weird. I don't know how, like, in one family you can have 2 different kinds. I don't know how that works. And then there's others that, I don't know, it's like 6 or 8, but there are several types of the disease.
There is also sickle hemoglobin. Apparently it's much worse than sickle, okay, not much worse, but it's pretty much similar to sickle cell anemia, because it has basically the same symptoms, just not as severe as the anemia. Yes, they get the issues of low blood and the side effects of being anemic, but then there are just no pain episodes in
Must
that.
Be nice.
No, it's not.
No pain episodes, but you have everything else.
They have maybe something else.
Anyway, but also each type of a disease presents differently.
Yeah.
Yeah. Like I know Byron's beta plus thalassemia You would have very intense crises, but they wouldn't be as frequent.
But the most common one is sickle cell anemia. So
Yes.
Oh, and also that's why we do not say that sickle cell disease only affects Black people, because it cuts across to different ethnic groups, different races, and it just presents itself in different ways. What's the difference between sickle cell disease and sickle cell anemia? Sickle cell disease is the disease.
Yeah,
Then
that's what you call it.
The anemia is the subset, like what comes with it. I think the best way would maybe, you can say someone has cancer and then there are different types of cancer. So that's the best.
That makes the most sense, actually.
The best example.
What are the symptoms of sickle cell anemia? Anemia?
Yes.
Feeling tired and fatigued a lot. Pain episodes. As a baby, swelling of hands and feet. I don't know, I haven't met an adult who gets a crisis like that.
I still get them.
Really?
I still get. It's called a thrombotic crisis.
Tell us more.
It's called a thrombotic crisis, where where your joints swell.
It must have been a really long time, because I can't remember. I know my parents told me as a baby they used to, but not when I'm old.
I still get them.
Do they hurt more, or just the small is the same, just swollen?
No, it's definitely more painful.
Another common symptom is jaundice, which everyone knows and complains about, that has sickle cell. I think those are the major symptoms.
But also it depends. Different people, different ways in which it manifests, different ways in which it shows itself. So.
And then after that, do the different sickle cell types present different symptoms? Yes.
Yes, they do.
Yes, they do. Not a doctor can tell you how specifically.
Google is your friend.
Sickle cell disease and STD.
Please.
Yikes.
Ask that question loudly.
Is sickle cell disease and STD?
No, it's not. It's not. It's not an STD. I don't even know how to answer that question.
I can't take it seriously.
It's not an STD at all. Wow.
No. Anyway, interesting questions.
Does sickle cell affect sperm production?
Yes, it does, in all seriousness. From what I was able to cite, sperm abnormalities are frequent in males with sickle cell disease, with rates as high as 91%.
Wow.
Sperm counts, density.
So that means when you want to have a baby, you need to involve reproductive health personnel.
Probably.
Or you might be able to have a baby. Have you ever had a pregnancy scare?
I have not.
You have not? Really?
Ever.
Someone is lying to you.
There's one mini Don out there.
Either you're too careful or someone is lying to you.
It's a lie.
Okay, fine. I've never had a pregnancy scare either. So. What happens when sickle cell disease is left untreated?
If it goes untreated and there's nothing wrong with you, lucky you. But I'm sure at some point you're going to need to find out how to treat and prevent a crisis. If it goes untreated.
To this question, so probably what? If you get sick, if you have sickle cell disease and get sick, if you leave it untreated, you're just, if it's a pain crisis, the pain crisis is going to get worse.
Yeah.
If you are anemic, you are just going to keep getting
more and
more anemic, which can eventually lead to death. So we would not advise you to not treat any symptom that comes with sickle cell.
Yeah, definitely.
Yeah.
Interesting though, I had read about someone who did not have sickle cell until they were like 18.
What?
Yeah, she had no idea.
How?
Until she got her first crisis.
And then they told her you have sickle cell?
Yeah, she was studying for uni, and she got into a bad crisis, and her parents had never told her anything.
But they knew she had sickle cell?
I think they knew. I can't remember, it's an old article I read like 2 years ago or last year. No, I don't think they had told her anything. I think they knew.
Anyway, some people are really God's favorite. So.
Does sickle cell get worse with age?
Yes and no. When I was a child, I had frequent pain episodes, but they were not so bad. I could bounce back very fast.
Yeah.
now my pain episodes are less, but when they come,
they're intense.
They are really, really intense. And then when I started getting my period when I was, I think I got my first period at 13, and I would be fine. I would go through the entire 3-4 days without any issue. But now each time I get my period, I'm going to have my 3-4 days of bleeding, and then the next week I'm in a crisis.
Full-blown crisis.
No, right now I'm in a crisis.
Yeah.
So right now I have pain from my head to my toe. I'm surviving on painkillers, and it happens every month. So every month I know for 1 week I'm going to be in pain.
Yeah.
But before I never had that. So yes, it gets worse, and no, because they are less frequent. And also it's more manageable.
I had less crises when I was younger.
Mm-hmm.
And more now, but they're both infrequent when I was younger now.
And the intensity of the pain?
Oh, the intensity is definitely worse now. Maybe I just forgot what it felt like when I was younger, but it feels like the intensity is much worse now. So I think it's subjective to everyone that has sickle cell. I don't know.
Yeah, even the recovery process for me now is so much. It's hard. I may not be in pain, but if I've been sick, I'm going to take about 2 to 3 weeks
the mental recovery
to just recover from the fatigue, the mental, everything.
Yeah, that's definitely worse the older you get. I feel like it's definitely harder to recover. Because
when you're a child, as soon as you recover,
back to
playing, back to having fun. But now I'm like, it's just tiring.
It interrupts so much more now though, because you're out of work, you're falling behind on emails or school or whatever. There's more to, when you're in a crisis, there's more to compensate from when you come out of it.
Yeah, because your life has stopped.
Yeah.
What is the life expectancy of a person living with sickle cell disease?
I don't like this question. Because you ask Google, it's like 54 years. But then I know so many people personally in Uganda who are like in their 70s. The oldest that we know of was a Nigerian lady who passed away at 95.
We don't have a deadline to life. We can live as long as we are meant to live. I can't say there is a life expectancy because, yes, there are children who have died at a young age, and there are people who have lived, like you said, as long as 90. So.
Yeah. What's the best age to test and detect sickle cell disease?
As soon as your baby falls sick.
Even prenatal. You should know that.
Okay. Ideally, test between you and your partner if any of you have the sickle cell gene. If you have the sickle cell gene and you end up having a baby, test before the baby is born.
Yeah.
If you did not know, test as soon as the baby is born or as soon as the first symptoms come through. They found out at 3 years. So.
Yeah, they found out at 1.5 for me.
That's 6 months. Why did I think it was 6 months?
Oh no, 6 months.
Exactly.
Yeah. No better than me. It was 6 months.
Yeah.
With my swollen hands and feet.
Or even my had swollen hands and feet. Who has the longest known record of staying alive with sickle cell? We cannot answer that question, guys. We can't answer that question because very many people out there live with sickle cell. They do not declare it, or they're not open about it. Don't say there's someone who lived up to 90, 93.
95.
I've read about I also read about someone who got up to at least 85. So I can't say there's been a biggest record to that at the moment.
It's not like anyone's keeping track right now either way, or were in the past. Never know, there could have been like 100 and something year old. How does sickle cell disease start? It starts when the mother and the father, or both carriers, have a child.
Oh my god.
Just to summarize.
No, the way you put the phone down, like as though you're going to demonstrate how it starts.
Rated 18
Yeah, anyway, it starts at conception.
At conception of child.
Yeah. How do you tell that someone has sickle cell disease?
For my answer, I just said you can't.
Can't.
No.
Yeah, you can't. You honestly cannot. I've been told I don't look like I have sickle cell disease, so
Yeah.
you can't. You honestly cannot tell how someone has sickle cell disease. Either they tell you, or you get to know their diagnosis through their symptoms showing. Can I date someone with sickle cell disease?
Why wouldn't you?
Like me, just
you yourself is you. I mean, why would you put yourself in that position?
You can't date me.
No.
No, look at me and tell me you can't date me.
I think you can date anyone.
You can't date me.
You can date anyone. Can date anyone.
You've turned me down on TV.
On live TV.
Oh my god. Anyway.
Yes, you can.
Yeah.
Of course I would.
You would not. You can date someone with sickle cell. They are normal people.
Yeah.
They just have a chronic illness, and I don't think that's something that should stop anyone. But if you feel it's such a burden to you, or you cannot support them the way they need, please stay away from that human. They deserve all the love and care, and if you can't give it, don't bother. That's my opinion.
Yeah, I agree. I don't think there's no reason not to date anyone with sickle cell. If you both have sickle cell, there is ways to plan around that.
Okay, honestly, I can't date someone with sickle cell.
Look at you. After all of that.
I can't.
So if you found out after, like you guys had been talking for a while, and he never told you before, but now like you guys are super close and he tells you, oh, by the way, I have sickle cell.
Yeah, like, honey, I will be there for you. I love you so much. I really, really do.
I'm supporting you from far.
No, not even from far. I'll be there when you are in a crisis. I'll be there if you need any help, I'll be there. I'll support you.
But we can't.
I've been there for you, right? I've been there. I've sat in the hospital with you. Come on, I'll do the thing. But I won't date you. I'm not going to date you. And personally, it's not because they have sickle cell. I just feel I need someone stronger. Yeah,
someone dependable. I mean, I can't imagine dating someone and you're both sick and you're both in hospital.
Exactly.
And yeah, who's looking after who? I don't know.
And the thing about that is also the mental stress on the other person can cause a crisis to the other person.
Yeah.
So for me, not dating you is a way of protecting you. It's not because I don't like you. It's just, I don't want you to suffer because I'm suffering. And I feel we feel what we feel. What you feel, rather. When you're sick, I feel it. So ideally,
yeah, it would be tough.
Which type of sickle cell disease is less painful?
They present in different ways, like we've said. So I don't know what's more or less painful.
What I think the best answer to that is that sickle cell anemia is the most painful because it manifests itself with the pain episodes. The rest do not really have pain episodes. The rest have, yes, the fatigue, the anemia. Some do not even have any symptoms at all. You just have the gene, but ideally, anemia is the one that has the most. That's the most painful.
We're built, we're the strongest. How long can you have sickle cell without knowing?
Honestly, how long depends on how soon your symptoms show. You said someone found out at 18.
Yeah.
You found out at 6 months. I found out at 3. The how long really depends on how soon the symptoms show or what your immunity is like.
Yeah.
And the silent complications, your organs are dying slowly without you knowing. Those are the silent complications.
Yeah, definitely. Just the effect of low oxygen in your
the lungs,
in your
the
body.
heart, the liver, the medications we take, we don't know what they're doing to us. Can stress worsen a crisis? Yes.
100% yes.
Yes, it can.
I think stress is the leading cause of a crisis.
It is, especially as an adult.
Yeah.
It's the number one reason we're always sick. Is lack of sleep one of the symptoms of sickle cell? It is a symptom. You have insomnia for no reason.
I mean, I have insomnia, but I don't know.
Do you think it's because, what do you think it's? I have insomnia, which doesn't make sense. But
I also know people who can sleep like a stone through anything.
Yeah, it happens. I also sleep a lot sometimes. But what I know, what I've started to study about my body is I can't sleep if my body is very tired. I'll feel uncomfortable. I may not be in pain. If my oxygen level is low or I'm fatigued, I can't sleep.
I'm trying to think if I've ever noticed that. I just know, for me, it's just like I can't sleep even if I wanted to. That's my insomnia.
But also when I sleep. I really sleep.
Must be nice.
But I think it is. It is a symptom. What are the best herbs of food for easing a crisis?
Personally, I am not a herbalist. I eat anything when I'm in a crisis.
Mm-hmm.
I guess the most important thing is just hydration during a crisis. I don't know how food would benefit or would be bad or good in a crisis. I don't know if there's specific foods you should avoid.
I think there are specific foods we should avoid, but I really do not avoid any food.
Well, they encourage like beetroot.
Yes, beetroot for anemia, hibiscus for anemia.
Yeah.
Liver as well for anemia. But I can't say they ease a crisis.
Yeah.
They do not take
It's
away
just
the
for
pain.
the anemia.
No, but they can help. I mean, if your blood level goes up, your sickle cell pain will go down. So they'll help in a certain way.
Mean, I hope some guys can tell us what are the best herbs. I only know hibiscus and.
But is that a herb? Okay, maybe. But I wouldn't call it a herb.
Yeah, it's not really a herb. Anyway.
There are also people who say if you boil avocado leaves, it also helps with the blood.
Oh yeah, I've heard that one.
But that's nasty, so I don't take that. I take beetroot and hibiscus mainly.
Same. Yeah, that does sound very not tasty. Avocado leaves sounds nasty. Does sickle cell also affect white people?
Yes. Yes, it does. Can local herbs cure sickle cell disease? No.
Nothing can cure sickle cell disease. Yeah.
Other than a bone marrow transplant.
Other than a bone marrow transplant when you're younger than 16.
And the gene therapies that are beginning to come up, which are not yet 100% sure. They're still experiments. But there is no herb on this earth that will take away your sickle cell disease. If anyone ever comes selling to you something,
they're lying.
Run.
They're lying. What are common treatments for sickle cell disease? I think we answered this before.
To repeat, again, the treatment is just try to be healthy as possible by keeping your blood levels up with folic acid, beetroot, hibiscus.
Yeah. Staying very hydrated.
Yes.
Avoiding stress as much as possible.
Try to manage your mood, because your mood is a very big factor in treating sickle cell or managing it. So when you get very angry or very excited, the adrenaline disturbs your body, so you end up getting a crisis.
I wish I learned that sooner.
What?
Just managing your mood.
But that's unfair. You can't say, no, honestly, you can't say I'm going to be happy till level 10. You can't say that. Can you say that?
I can try.
No, you can't. In all honesty, you can't say I'm going to be happy to this extent, or I'm going to be angry to this. Okay, the anger, I'm beginning.
The anger part.
I'm beginning to manage my anger.
The anger part especially. Anger and frustration. I wish I'd learned how to just let it be, Aliyah.
What about happiness?
I mean, you can't regulate happiness.
You just be nonchalant about everything.
No, just be excited. I mean, okay, yeah. Happiness can cause a crisis.
Yes.
Anyway, yeah, I remember your birthday.
I get erections even when I'm not aroused. What is that?
It's called being an adolescent and an adult. I mean, guys are weird. Our biology.
No. I think, and this is a question to you, I think this is best of Priapism.
So what causes that? I know it's a fluctuation in our testosterone. So if we have too much testosterone at night, the blood is flowing and it doesn't get let back out. Yeah, so that's what causes like painful erections in the middle of the night, or middle of the day, middle of the night. I don't know.
So how do you manage that?
From what I've been suggested, just light exercise to get your blood flowing, a hot shower. There's nothing you can really do. I don't know, take a pain med if it's really that bad. But I know if it lasts longer than 3 to 4 hours, you need to go to hospital immediately.
So what do they do at the hospital?
They give you blood thinners They inject you with blood thinners so that it goes down by force.
Okay.
Yeah, since you wanted to know.
I still want to know. I have so many questions. Describe the pain.
It's like a crisis. It's like a really, really intense crisis that doesn't have waves. Like, you know how in a crisis it like a pain comes and goes. It's just constant.
So you have an erection and it's painful.
Painful as hell, and it's constant pain.
And the best solution is to shower.
Light exercise, or there's a medication that a doctor at Case told me to take, and it's been helping. I don't know what type of medication it is, but basically it lowers your testosterone.
So that again affects you.
Yeah.
Does that affect your performance?
Yeah, and then sperm count, all that shit. We're also going through it.
Sorry.
But yeah, the pain is wild. So that pain's crazy.
Okay. Thank you for watching Sick Conversations. We will leave you on that very serious note.